Welcome to episode 3. This is the Skin Deep Belfast Derm Doc podcast. And I'm here with the Derm Doc himself. It's Dr. Bryan Murphy.
Hello.
He is a skin expert. He's the skin expert at Cathedral Dermatology. And you have a guest, a wonderful guest who's going to share her knowledge with us.
Yes, this is Dr. Suzanne Clements, a good colleague and friend of mine who is a consultant dermatologist at Belfast City Hospital.
So we have 2 experts today, and this has been the episode that I've been dying about. Okay, this is the one that I wanted to talk about. This is spots. I love it. I am one of those people who loves to watch squeezing spots online. I do. I love to do it. But you guys get to do this for a living. You're so lucky. You're so lucky.
I love squeezing with your black head.
Yeah, you're so lucky. No, I kind of jest. No, these people are skin experts. Mm-hmm. But things like acne, it's a huge problem, and it's absolutely horrendous, and it's something that largely affects young people, I guess, but then older people get it too. I see people my age, and this is like a lifelong condition, and a lot of people go to their GP who's like, oh, you're fine, no one ever died of having acne, but it affects mental health, it affects everything. Huge. So let's start with that and what we can do. Bryan, what can we do about acne skin?
It really depends on what type of acne you have, because everyone thinks it's the spots that we had as a teenager on our face and upper back and nose. But there's so many different things contributing to why spots arise. Things are common, increased oil, sebum, which triggers that. Or indeed on the back, some people can have a yeast triggering it.
Right, okay.
And then what some people might call acne is actually called folliculitis, which is
so it's not acne, it's just something like it, right?
Yes, so it's where you're getting pustules, but it depends where they're coming from.
Yeah.
So there's various different things in life that might manifest like acne. And
so the diagnosis is vital.
Yeah.
And your average GP, again, I don't want to sound like we're slagging off GP because we absolutely aren't.
Not.
We know that they have 6 minutes, at best. And they can't be experts on everything, and they'll just give you whatever and say, yeah, you're fine, So then a lot of people are just sent home and they're scared to show their faces. And in fact, something like TikTok is amazing because I've seen so many videos of really brave people taking off their makeup and it looks so painful. Mm-hmm. It actually looks so painful. So what's the first step? Obviously coming to something like Cathedral Clinic and seeing an expert like you.
Come and see us. We'll chat about your problem, where it affects you on your body, your skincare regime. I think is that I talk to all patients about their skincare as first step, because optimizing that with minimizing things that increase grease in the skin, putting too much makeup on, or too many layers, as we spoke about last week, keeping that as simple as possible, oil free. So looking for on bottles anti-comedogenic oil, anti-oil or oil free.
But what if it's not that? What if it's not their skincare?
And then going into what we can add into that as the next step, which would be topical treatments. What would you say first?
I think there's different types of acne. So different types of acne lesions respond to different types of treatment.
So it's complex.
So it is more complex. So for example, you've heard of blackheads and whiteheads.
Yes.
And the proper term for that is comedones. But
what are they called?
Comedones. So when you say non-comedogenic,
I've never heard that word before. Comedones.
Comedones.
I've learned something new.
So blackheads and whiteheads are comedones, but they respond to slightly different treatment than the big red sore spots.
Yes.
So it's figuring out what kind of spots you have, and the treatment might be different depending on your type of acne. But usually you'd start off with prescription strength gels and creams that can help, and then if that's not enough, you're thinking about adding in a tablet treatment.
Like Roaccutane, is that what you're talking about? Something like Roaccutane?
So Roaccutane is a very good treatment for acne, but it would probably be the top end treatment. So we normally would like to try and
you want to try something
tablets
first, right?
Before that, yeah.
Antibiotics.
Antibiotics at first, I guess, because it just looks so painful. Some of these it's always girls I see on TikTok, and it's just awful. But older women as well. It seems to be something that's happening in older women. Hormonal, the menopause, the gift that keeps on giving. They start to get the spots, and it is heartbreaking. It doesn't. You must hear some sad stories.
Absolutely.
They're heartbreaking. These people are just at their wits' end.
I think a lot of people feel why I'm no longer a teenager. I'm
yes.
in my 20s, 30s or older. Definitely with our female patients, we see a hormonal trigger.
Yes.
Because you're having monthly cycles.
Yes.
Where the androgens and different levels of estrogens are changing, and that can be a stimulus, the androgen levels. So it's recognizing that, and as Suzanne said, some oral treatments, obviously one is antibiotics, but some patients end up speaking to their GP or going on to the likes of contraception because they can help regulate some of those.
That'll regulate it. That will regulate it.
And that is one potential option. And then increasingly so I would use a lot of spironolactone, which is ironically a water tablet for people with heart failure, but it's been found to have fantastic properties. I see great results for female patients with particularly lower face and jawline hormonal acne.
And have you ever been stumped? Like, have you ever treated a patient and gone, I can't do anything for you?
You do get complex patients that make you have to, and you have to think more widely. So, most patients come in and it's a very straightforward, in our heads, like, oh, ding, ding, ding,
it's fine,
I know what to do. But yes, you will get complex, more severe acne types, and that requires slightly
various
more
different
nuance.
treatments coming in at once.
I would definitely recommend someone who's got a more severe acne type. My recommendation would be you come and see a dermatologist because the treatment is really quite nuanced at that level. And you need to be seeing someone who really knows the skin really well. So if it's really severe, I wouldn't hang about.
Why I ask that, because I know a lot of people go, well, I've been everywhere and tried everything and nothing works. It does work. Dermatologists can help you.
Yeah. Absolutely.
Yes.
And there's so many, I hear so many stories and myths, as we call them.
Myths,
when
of course.
People come through the door and what they've tried, and they've cut everything out in their diet, and they're using X, Y, and Z from online. And a lot of the time that was probably making it worse.
Yeah.
I'm a huge believer in that. Yes, there's some small bits of evidence in terms of certain dairy products that might contribute to acne, but cutting everything out of your diet is certainly not holistically healthy for you. So no wonder your skin is not good. So it's about seeing someone who knows what we're dealing with, what we're talking with, and so we can get you on the right treatment at the right time. Because there are certainly some patients who are so severe, we would call that a condition called acne fulminans, where their acne is so severe you could potentially become unwell, and those patients probably need to go Accutane for.
Makes me really sad. That makes me really sad.
We see obviously there's lots of different, there's a big spectrum of what acne can look like, but unfortunately we do see the more severe end. And I think in terms of recommending patients to get treatment, if your acne is very severe and you have big painful cysts and nodules, really sore red ones,
so painful.
Then if they're that level, then the earlier you get treatment, the better.
Yes.
And that's to prevent scarring.
Yes, tell me about the scarring. What can you do about the scarring then? Can you fix that?
Scarring is something that if your acne is still active, we wouldn't advocate doing scar treatments in the short term, because you really don't want to be investing in all the sorts of different treatments for scarring whilst you're still developing spots that potentially can lead to scars, which for the majority of the scars that we see, it's a history of severe acne or small abscesses and lumps under the skin that pop that cause damage then to collagen and tethering in the skin. So we can treat scarring. People tend to come immediately thinking that they have to have laser for everything, which is a fantastic.
The lasers do work,
but it will depend on people's budget, their tolerance, their downtime. So and depending on your acne scarring, there's things even simply from the point of view of even blemishes. Sunscreen is important to stop those things getting darker as the post-acne staining fades. Retinoids in themselves, after your acne is cleared, are actually great at helping to increase how quickly your skin turns over to resurface and replenish. And then going down the lines of your instrumentation device treatments, whether it's microneedling, peels, or laser.
Yeah.
So there is help.
Absolutely.
There is hope.
Definitely.
There is hope when there is help.
People do delay sometimes because they think
it'll go away.
Themselves.
They think it will go away, and they minimise it, and it's not super expensive. I mean, we're not talking thousands and thousands of pounds here. We're not.
No,
it's manageable.
No, it's definitely a lot more accessible and affordable.
Help is at the end of the phone, basically.
These days, absolutely.
And that's the one thing I really want people to hear, that there is help. You can go and see these people. They will help you.
We like treating acne.
Me too.
Do you? Yeah. It's a challenge.
Because we can make it better, and it's lovely seeing patients come in who are really badly affected.
What's it like whenever they come back in and
they're
they've
clear
cleared? What's it like? Are they all like, oh, look at me?
Yeah.
The big smiles when they get better,
so
isn't
happy.
it?
Yeah. There's obviously no pain, no gain. Roaccutane is one of those drugs, as you'll see from TikTok, a lot of side effects, and it's not always the right choice at this moment in time for every patient. But having got through it and realised that actually those dry lips and dry nose,
it's worth it.
It's worth it.
It's worth it. Okay, can we talk about blackheads, please? So, do those strips work? No, they don't. Do they? Those nose strips, they don't work.
I haven't tried them myself years ago.
I tried them years ago.
I didn't think so.
I
never got the one where it comes off like a big mound.
Those aren't blackheads on. Those aren't necessarily blackheads on your nose. They are sebaceous filaments. Are they not?
Yes.
On your nose.
The little tiny ones.
Yeah.
Tiny wee
Should
bits.
we be squeezing these? Ever?
I don't think you should. Because
But it's fun.
You can lead to bruising, and potentially you can obviously cause potentially risk of scarring in yourself by traumatizing your skin, and that's why there's the right ingredients, the right products. As we said, there's different.
You'll not
types of
have them
acne.
then.
You should be able to
Minimize them without
Lift them out without squeezing.
Because what a blackhead is the sebum and the keratin trapped within that pore, which is oxidized with the oxygen, so it goes black.
That's why it goes black.
Yeah.
So
Can we talk about dilated pores of, what are they called? You know what I'm talking about, right?
Yeah.
Those are those big, massive,
Big ones.
massive blackheads that people get in the middle of their back, and you see them on TikTok, and it's like some old woman, she's about 80, and they're bringing it out. What is that? Do you get that often?
Oh, you do see that.
I've seen one. I've seen one in the wild. I'd just like to say.
I think it's very much an occlusive issue. So it's maybe I've seen it wrong fitted bra and very
for rubbing
together. And
it's
just,
rubbing.
it's just basically there's a lot of sweat and your body has no time for that to aerate.
Yeah.
And it just occludes it. So it tends to be that type that you're talking about on the back.
So what do you do? Do you poke it out?
Occluded or sweaty back that's been too tight with clothing.
It depends if it's bothering somebody because it's not harmful as such. So if it's sitting there quite happily,
mind
and
its own business. It's not going to
you could just leave it.
And what is it? What's in there? What's that hard stuff?
Dead skin cells, keratin and oil all clugged together.
And then there's all this sort of yellow stuff that comes out. What's that?
You get usually with the blackheads, you tend to get just the
like a spear.
It's not
like a spear.
I don't ever find it.
Don't worry, our listeners know what I'm talking about. They know.
The yellowy cheesy stuff is more cysts.
Oh,
but the blackheads, you tend to get this little chunk of just hard.
It's beautiful, beautiful. Okay, and then what about those things that I see on TikTok, the pimple popper, those big lumps that people have? What are those? You know the big lumps that people go, I've been living with this for 35 years. And you're like, it's like another head. What are, like, people have them smaller, they have them here. What are those called?
They're epidermal cysts.
Epidermal cysts. Mm-hmm. What is inside that? You explained this to me once, it was beautiful. This is beautiful.
What Suzanne said, it is literally, it's just it's whereby the majority of these form in and around a hair follicle lining.
Right.
Whereby part of that lining is just become trapped off.
Yes.
And you're getting those sometimes fragments of the cells that were meant to make hair, keratin, oil, debris, and whatnot, just stuck, and then it just balloons up. Some of them reach the surface, and you see a little bit that's a dimple. Then some of them don't, and they're underneath the skin, and that sac just is holding that all together.
You just cut it off.
So we can remove them. They tend to need to treat surgically. Some people in areas like around the face might prefer to try an injection with steroid first.
Yes.
Don't try this at home.
No, don't. This is why you have to go to the experts. Don't listen to me. Listen to the experts. Don't go on TikTok.
Yeah.
But I think it does fascinate us. Now, the other thing that I asked you one time before, because I want you to say it on camera, you know, sometimes that you wake up and you've got this massive second head growing out of your cheek, and you've got to function in you're getting married in 4 days' time.
Yeah.
Can you fix it? Can you inject it? Can you do something?
What would you do?
What would you do?
Personally,
I'm getting married in 4 days.
What would you do?
I'm getting married in 4 days.
Squeezing it.
What do we do?
I think in the short term, things like sometimes a bit of topical steroid.
Yes.
That's the winner.
Just really reduce this inflammation pretty quickly. The risk with the steroid injections, yes, they do work and have had some great results for patients, but with something so important in a few days, the risk of that maybe introducing infection and so forth, I would avoid.
What would you do?
No, I'd do the same. So it's interesting because we don't normally put topical steroid on acne. It's not really an acne treatment, but if
it's a quick fix.
It's a quick fix.
Yeah.
So you wouldn't do it for very long. You'd maybe for your 3-4 days before your wedding.
Yes.
It will make it look a bit less red.
Yes.
So that would be
that inflammation.
Yeah.
Yes.
Try and settle it out.
And then the other thing that, of course, I want to ask you about is, you know, those trapped hairs, and then you pull them out and it's like really, really long. Do you do many of those? I'm grim, aren't I?
You've been watching lots.
Yes,
I
think we're into my specialist subjects now.
I actually don't see it.
Trapped hairs.
No, I don't have to say.
How do you stop getting trapped?
We don't see that.
No, I do.
People just do that at home, do they? Good for them.
I do see a lot of people more in sort of friends and colleagues who work in the beauty industry would say they have a lot of ingrown hairs.
Yes, but they don't come to you for that. But you can.
But
Please step up.
Something we could help with, and we have a look at it.
Yes.
You know, certainly it's like anything, as we said the other week, in terms of lumps and bumps. A new lump that doesn't heal, you know, and you're not sure what it is, come and get it checked. And, you know, it's very satisfying to reassure someone, said, yes, ingrown hair or
skin tags.
Cyst.
Skin tags. What about them? Can you deal with it?
Absolutely.
I have a skin tag. I showed him. And you can deal with those.
We can deal
what
with
are
those.
skin tags? Why? What are they doing?
Skin.
Why are they growing like that?
They appear usually,
Yeah.
It's usually where skin creases are, skin folds, or a bit of friction. So it's usually around the neck.
I don't have one here. I have one on my underside of my arm.
So it's neck,
Why?
armpits.
Why?
You know, underneath the breast area.
Groin.
So it's kind of
Boils. Is that something you deal with?
Boils are, I suppose, the layman term for a big abscess, which is just a deeper, big aggregate of inflamed, infected cyst, pus.
Okay.
So it's maybe not as old as a cyst where it's keratin. It's usually pus that fills around a follicle or a pore, and absolutely we can deal with those as well.
There's something about listening to this that just scratches part of my brain. I don't know what it is. It's just delicious. It really is. I love hearing about it. I love hearing about spots. But what I've learned today from you two is that you can fix things.
Yeah.
You could, like, there is nothing to be embarrassed about. No. If you have a big boil in your backside, go and see you. There's nothing you guys haven't seen. No. So if anybody listening to this has acne, boil, skin tag, weird little bits and pieces, please go and see these two at Cathedral Dermatology, and they'll sort it out, and you'll be okay. Now, next week, what are we talking? Next week, we're going downstairs, and we're talking about skin, not on our faces and bodies, but in our private regions. So that's going to be a really interesting chat, and one that I'm really interested in hearing all about. So thank you very much.
Thank
you.